The Pulse nightclub shooting in Orlando in June is the deadliest mass shooting in U.S. history by a single shooter. 49 people died, 53 others were wounded.
Of the 29 victims who underwent emergency surgery at the Orlando Regional Medical Center, all survived. In tonight's Health Watch report, Channel 3's Catherine Daniel takes us to meet a local doctor who was part of the on-call team who helped save those lives.
Channel 3 Health Watch, sponsored by Sacred Heart.
Surgeon Shonak Patel was on call June 12, 2016.
3 texts in a row, mass shooting, ORMC, come immediately. And at first I didn't believe this because I've never gotten a text like that.
Patel went straight to the emergency room.
It was unlike anything I've ever seen. I couldn't even describe a movie like that.
One young man caught his eye, unresponsive, his vital signs plummeting.
They had 6 operating rooms open by that time, and there was no availability. And I thought to myself, he's not going to make it.
More victims arriving by the minute.
There were people that were minimally injured, and to me, I felt like they were more traumatized because they were more aware of what was going on, so they were crying, screaming.
For the next 12 hours, Patel triaged patients and performed surgery as an emergency team of more than 500 pulled together.
People did things outside of their role. You saw doctors helping clean up just to make room for someone else.
Patel says that spirit of camaraderie lasted for months. He's avoided a lot of news about the attack and will not listen to the recently released 911 recordings of the shooter, and he rebuffs any praise.
The only reason to speak about it is to share your experience and hope that others can learn from areas that could have been improved.
Patel says he thinks that eventually many people will learn how to perform hemorrhage control by holding certain pressure points so bystanders will know how to stop victims from bleeding out after a mass shooting. Tragic, but possibly crucial knowledge for lay people to have.
I think that in the very near future, it's going to be as common as CPR or the Heimlich maneuver.
Patel and his young family just moved to Pensacola. The vascular surgeon will also take trauma call at local hospitals. Instead of focusing on the violence and the pain, Patel says he tries to remember the teamwork, healing, and progress of the first patient he saw that terrible night.
Multiple gunshots. His vitals said that he should have died, and we saved his life. And that image, that picture will stay with me forever.
Catherine Daniel, Channel 3 News.
For this story and other health news, we invite you to visit our website and click on the Health Watch tab.